Today I'm going to share some AI, a specific AI tool that I think will address some of the issues that I've had with what our project is doing, which is to come up with some kind of mechanism or tool chest to best support education. So I think we have academic preparation, which is important. We have on-the-job preparation. We have some other things, but I think to get ahead, we need to create in ourselves a strategy for becoming prepared. And I think this particular tool puts it in a different light than I had thought of before. And there's some aspects of it that I think will be very helpful. So I'm not an expert at it. I'm just going to share what I know. I'm going to go through it with a couple of examples, and then we'll have a conversation about it. Sometimes difficult to figure out what it is you need to know, which is why we created this cafe, to help create some kind of a guide for folks. Now, as AI is evolving at an amazing pace, the power of its application is going to grow, and it's also going to change. The paradigm change will be how we look at education. Now, if you go to college and it's university, any kind of coursework, it's kind of pretty similar to what it has been over the years. This may change the way that we study. It'll change the way that we become, I think, aware of the issues that are important to us. So today, I think I'm going to start with this, which is all of my conversations are based on action. If at the end of this presentation, at the end of today, you don't feel inspired and you don't have more questions and you don't feel like you can act, then I haven't been successful. If any of those things happen, if you feel a little bit more excited about doing things, about taking advantage of this, moving on, if you have some questions, if you want to dig into it, you want to be inspired, then this has been successful. We're going to talk about creating a plan very briefly. I'm just going to gloss over that and remind everyone that the nursing process is a wonderful tool to help us intentionally address issues and to apply that into our practice with becoming prepared. And then I'm going to introduce Notebook LM. Some of the problems that we may face when we're addressing some extracurricular tasks, which to me is something we all should do. I think our culture, our society would be better suited or better, we would be able to achieve more if we became more of a volunteeristic society, to where outside of work, we take on our hot buttons, our issues of choice. If we look at volunteerism, I think that's very important. But how do you do that? Because we all have time constraints. We only can deal with so much emotionally. We have work, kids, family, things come up that may stress us in a way that prevents us, or even it may cause us fear to do anything more than just go to work and come home. We may not be aware of what we need to know, and that may be a barrier. Organizationally, it may be very difficult to jump in to address issues, policy issues, because of the way that things are structured organizationally. What is very important is that we have support and that we have a knowledge base. And nurses, I think, particularly are affected by not feeling like we don't know how to do a thing, and that prevents us from doing a thing. It seems like we want to wait till we're experts sometimes before we do anything. You don't have to do that. You can get started, just get started. And it's helpful to have some support. And that's what this cafe primarily is designed to do. So I put this together a long time ago when we started the cafe. It was my idea of how do we go about creating a strategy? Because one of the first things that people say is, I don't know how to get started. Well, when I became a nurse, I was 50. This is in 2010. I felt like there were four main things that I needed to know. I needed to know how to publish. I needed to know how to do research. I needed to know how to function on a board, a shared governance meeting, like a committee meeting. How do I function on that? And I wanted to learn how to public speak. So I had a couple of ideas. I was not prepared to do any of those. And so I started to think about the things that would help me become prepared. Like I joined Toastmasters and I started to look for opportunities to present, whether it's posters or in the community. I looked for opportunities. So this is my sort of a logic model for a personal and professional development plan to become an effective policy nurse entrepreneur. I have to assess myself first of all. What am I lacking? What do I need? What are my skills that are power? And what are some of the things that I'm lacking? So then the next step would be to identify where to gain those skills. How can I become expert at some of those things? Started listing that. And the next thing, without question, is action. You have to do something. Thinking about it won't get you anywhere. So that's my process. And then it comes back to evaluation and back to reassessing. What have I learned? What do I need to know? Most of the time at night, I'd come home and go, boy, I should have said that. That happened to me a lot. But if you look at it this way, the nursing process is really the best approach. We can utilize this tool that's unique to nursing. Now, other professions may have a similar tool, but this is ours, and we should take advantage of its power. Self-assessment, diagnosis, being able to identify problems, and then create some kind of a plan so it's intentional and not accidental. Then we do something, and then we look and see how that worked. What do I need to learn now that I know that? So this is just another way to think about it. Peer feedback is very important. I think I included this simply because I feel like we need to talk to one another, and that's one of the functions that we have in the cafe. Is we have a global cafe where we have a map, and you can pin your location with a bio on yourself and what your interest is, so that you can connect with other people. We need to talk to one another. Once a month at the cafe is helpful, but wouldn't it be great if you just all throughout the month you could call somebody, say, I'm working on this, kind of struggling. What do you think? It doesn't have to be a formal mentor mentee. It could just be peers. These are some of the skill sets that we've identified. You've all probably seen this more than once. All of this is not all inclusive. There's much more to know about this. On the bottom, if you look down at the base, these thinking about thinking is important. We should be experts in understanding why we think about things and how in our mind we create mental models and our worldview so that we are coming from a place of intention. So there are a couple of ways to think about that. Systems thinking, I think, probably is the most important, because when we see a failure in a societal problem, whether it's homelessness, suicide prevention, mental health, whatever issue it is, there is a problem with the system. And understanding how systems could be developed and created in a way that they're effective. And if we become experts at doing that, then we're going to be drawn into all those decision-making groups. They're going to request us, not just hope that, not for us, not just hope to be accepted. We will be looked at as experts if we have a better understanding of how systems work and can utilize that understanding to be thought leaders and to advocate for reform. This is something for you to look at. What are some things that you are either uncomfortable with, don't feel like you know much about? Pick out a couple of these things, and every month, just spend an hour working on skills, thinking about how you can develop that. Our website is constantly expanding the content. And ideally, we'll have something to support all of these, but we are never going to be all inclusive. We're not an encyclopedia. That's not our design is. It's to help you get started, a launching board, so that you can find some of the resources. We're going to have some, and that's going to grow. What about AI? Now, there's a lot of discussion. It's scary because it could be really bad. I just called our home warranty office yesterday, and they've decided to go with the artificial unintelligent model when it comes to using the telephone. It took me 30 minutes to get to a human being because it just rolled in a bad way. So with artificial intelligence, they've been developing the process of interacting with us and gaining information and giving it to us in formats that are helpful for us as individually. Those are language models. Using large language models, they're able to better identify what it is that we need and frame it in a way that we can accept that and utilize that unique to us. Also with AI, we're able to get immediate feedback. You don't have to wait 8 hours for a radiologist to read your x-rays. We don't have to wait. It could be instantaneous. We get feedback. So when you're learning a thing and you get instant feedback on how to change what you're thinking or how to think differently, that's powerful. Continuous improvement. AI can help us and generate a pathway for us to gain a strategy for how do we improve ourselves. There's some concerns. Who writes the code for this AI stuff? Obviously there could be bias, and we could be taking down the rabbit hole. If you all use Facebook or any kind of social media, they have algorithms. If you watch a video for more than 2 seconds, you go in a particular algorithmic pathway, and that's the stuff you're going to see. My wife is always saying, how can I see this and this and this? And you never see that stuff. Well, it's because of the pathway. And it measures how much you look at a thing, and that determines what you're going to be fed. So there's some concerns with that, of course. What does it look like in the future? I'm not sure. I can't even envision what it's going to look like in the future. It could be very scary, but I'm sure there's going to be some powerful changes in the way that we learn and influence society. We can customize learning content for what we need. If you take a course, you take Lit 101, you are going to get fed the exact same thing as somebody who's also taking remedial English at the same time. Everybody gets the same thing. With AI, we can identify specific learning needs for you, the content and the approach that you need to learn, specifically for us as individuals. That's a big step in education. AI can create scenarios. It could create scenarios for us to practice what it is, and it can give us immediate feedback so that we're actually developing skill sets and improving our perception of self-efficacy and confidence in our belief that we can actually do a thing. And as we get better with this, they're going to be more interactive and they're going to be more adaptive, the educational tools that are delivered through AI, through the training. We're at an amazing point in humanity. I just hope that we can take advantage of it. Some other things, I didn't need to put that slide in here. So Grace shared this with us. Google just came out, I don't know, it's been a year and a half, Google Notebook, LM for language model. It's an interesting tool, and it changes the way that I think that we can learn. This is what it looks like. So if you have a Google account, you open up, you see this, you go up to this menu. This is, I don't know, robotics for menu. They can't use letters, they got to use icons. And you look at the different apps, it looks like this, Notebook LM. Now on yours, it may be buried down here. You may have to search for it. When you do, you can move it up however you like it. So this is our cafe account. I open it up and they've got some features that you can look and see. These are models, these are exemplars for what other people have done. So you could take a look at what they've used, how they've approached using this tool. We have a couple here. What I wanted to show you was this one. This is the one I've been playing with. And I'll walk you through how we did it. It wants you to add sources, and it calls all of these sources. A source could be a URL. It'll only read PDFs, so you can't insert Word documents. It has to be a PDF. So if you do have a Word document, you just have to save it as a PDF, and that you just add it to this. So it collects all of these. These are all papers. These are all papers with nurse policy entrepreneurship as part of the relationship to what we're using. So I enter in all of these, and it immediately creates a brief overview of all of that stuff. It's taken thousands of pages, and it's created this. Now, it's not going to be perfectly accurate, but it is going to give you a big piece of knowledge in a short period of time over a lot of documents to kind of get an overview. And then what you have over here is the studio, and these are the different things that you can do. With the audio, I have all of those documents in there with an audio, it will create a podcast. So it can be a deep dive podcast of, I think, like 20 minutes of two people talking to each other. They're AI generated, and I got to tell you, they sound pretty good. I put my doctoral paper on there, thesis on there, and it's got 20-minute overview of my paper. And to me, it sounded pretty dadgum good. I like what it said. I would like to change it. And from what I can see, I can't revise it. I can't yet. But I think as I learn to use the prompts, I can aim it a little bit better and maybe somehow do that. So there's a learning curve in here. This one's briefer, and you could do the short default or longer version. A critique, a different approach to evaluating and critiquing these papers, and then two people debating these two papers. So these are three different ways that you can save an audio podcast of these data. This is really just a bunch of data, somebody's narrative prose form. So let's say you did all three of these. You save them as an MP3, is that what it is? I think for the audio format, and you save it, and you could take that and drive. Let's say you want to review one of these papers. You could do this, and it will give you a podcast of that. And so it's different ways to think about that. You can affect shorter, longer, default. You can do change the language. It's got a couple up here. She's got them all, of course. And then there's some things that you could help focus it. Now, this is, I think, if you're going to become an expert or improve your ability to utilize these AI, it's going to be on how do you write prompts? How is, and same thing with like ChatGPT and some of the other AI tools. Writing the prompts is what the magic, that's where the secret sauce is. It's not going to be writing code. People are not going to be writing code any more than people are putting horseshoes or blacksmithing. The AI will write the code. What we're going to do is be able to define very specific parameters, the limitations for what it is we want, whether the quality of it, the tone of it, who's the audience, all those things. How do we write the best prompts? So you'd have different. Now, if you wrote one here and you said, you know, it's not really what I'm thinking, I want to put some other prompts in here and hit it again. I haven't done it, but I think that will give you a different podcast of the same content. So so here's audio. Same thing with the video overview. Before I show you anything, it will create a PowerPoint presentation. That'll be the video. It's not going to be people talking. It will be a slide deck. So if you have something and you just want to briefly share it with people, you can make it, a 10 slide deck thing just like that. It will bring it out. Now, of course, you can go in and edit that because it is a slide deck. And you probably will have to. It's not developed, I think, enough to trust it entirely. You can create a mind map. Well, it'll schematically show the different papers and what they're doing. I don't know how well developed that is. I've tried it. It just didn't look all that great. And then it can write reports. So you can write a briefing doc, a study guide, and even a timeline. Let's say that, like with this cafe, if I put in the data when we started and all the points, the data points along that time, speakers, when we got on LinkedIn, when we did such and such, it will create a timeline for us like that. That's always been difficult for me because if you use Word or PowerPoint, you can create the format, but it's still got to dump the stuff in there. It can be time consuming. Let's see. Now this is a study guide. So let's say that you're studying this. I want to take this and I really want to get into this, the content of this stuff. It will create a quiz and an answer key. It will give you essay format questions. It will give you a glossary. It will give you everything that you need to study. Now, I'm not sure how to expound upon this. We may have other things. Let's say you're teaching a class or you're doing an online presentation. You want to throw out a quiz. How do you change those? I haven't gotten there yet, but I think it's possible to revise those. If it isn't now, this is all in beta. So they're still developing this. It should go. Let's see what else they have. fact sheet, so it'll create a fact sheet, a briefing doc, so it'll create more of a narrative and overview. That would be helpful. If you're just sitting and you want to review all these in text form, you can do that. So with this add note, that's where you want to put in your parameters if you want to add things to this. I think that's how it would work. I haven't tried that yet, but I think that's a pretty good feature. And once again, this is in beta, so it's going to evolve and it's going to emerge. But let me just let you listen to this quick here so you see the sound of it.
Let's talk about a huge, kind of strange paradox that's sitting right at the heart of our healthcare systems. It's all about nurses, the people who actually deliver most of our care, and why, for some reason, they have so little say in the rules that run the whole show. We're going to break down that disconnect. It's a wild reality when you stop and think about it, isn't it? Nurses are, year after year, ranked as one of the most trusted professions on the planet. And yet, when it comes to those big, high-level decisions that shape health policy, their voices just aren't in the room. So in this explainer, we're going to dig into why that gap exists, and, more importantly, how it's finally starting to change. Just to get a sense of the scale we're talking about, look at this number, 27.9 million. That's how many nurses there are around the world. They make up nearly 60% of all health professionals. They are, and this is no exaggeration, the absolute backbone of every single health system on Earth. So on one hand, you've got this massive, incredibly skilled workforce, and on the other, you have a policy-making machine where they're just barely represented. So we're going to break down exactly why this gap exists, and then we'll get into the really cool part, the tools and strategies that are helping nurses build a bridge and create better, smarter healthcare for every single one of us.
Okay, so first things first, let's just lay out how big this contradiction really is. We're not talking about a tiny little difference here. The numbers, well, they paint a really clear picture of a massive influence gap.
And wow, this chart just says it all. The bar on the left, that's the huge percentage of the healthcare workforce that nurses make up. The one on the right, that's their slice of the pie and policy roles. It's tiny. I mean, one analysis in the Catalan Health Service found that nurses made up only 5 or 6% of the staff at headquarters. And get this, 0 of them were in top leadership roles like minister or director general. And this isn't just a one-off thing, it's a pattern you see all over the world. So, we can all see the gap pretty clearly. The real question is, why? Why is it there in the first place? Well, to answer that, we've got to look at the barriers that have been keeping nurses from the decision-making table. Okay, so there's this really useful concept from political science called the iron triangle. For a long time, 3 main groups have basically run the show in healthcare policy. The state, so the government, the medical profession, traditionally doctors, and economic experts. These 3 form this really powerful, tight-knit core. And as you can guess, nurses have historically been left on the outside looking in.
So what's actually keeping them on the outside? Well, research kind of breaks the barriers down into 3 buckets. First, you've got personal factors. Then there are the organizational barriers. I mean, just think about it. How are you supposed to show up to a policy meeting when you're working these insane 12-hour shifts that change all the time? And finally, you have these big professional hurdles, like stubborn stereotypes about nursing and the fact that a lot of nursing schools just don't teach the political side of things. Each one of these layers makes it incredibly tough to break into that iron triangle.
All right, but here is where the whole story takes a turn, because this isn't a permanent situation. A new way of thinking about how to drive change is taking hold, and it's all about becoming what researchers call a policy entrepreneur.
So what is a policy entrepreneur? It's somebody who doesn't just sit around and hope for change. No way. They actively invest their own resources, their time, their energy, their connections, to go after a specific policy they believe in. They're driven by a real ambition for a better way of doing things, and they work to build the credibility to get other people to listen. It completely reframes advocacy from this passive thing into an active strategic mission.
And here's the playbook they use. The policy process isn't some chaotic mystery. It's actually a roadmap with clear, predictable stages. It all starts with just identifying a problem. Then you've got to fight to get it onto the official government agenda. From there, you move through formulating the policy, getting it approved, putting it into action, and finally looking back to see if the new rule actually did what it was supposed to do.
And this is the absolute game changer, right? Once you understand this map, you know exactly where and when to apply pressure. You can aim your efforts at a specific stage, like just raising awareness to get a problem on the agenda, and you can seriously increase your odds of making a real, lasting impact. Okay, so let's see what this looks like when you put it into practice. Some fascinating research on local anti-fracking campaigns in New York actually uncovered 3 totally distinct types of these policy entrepreneurs. So, the researchers found these 3 archetypes. First, you have the concerned citizen. This person lobbies for change, but without much strategy, and honestly, they have little to no impact. At the other extreme, you have the activist, who does everything, builds coalitions, uses a million different strategies, and yeah, they get results. But here's the surprise. It was the one in the middle, the advocate. This person is less active than the activist. They focus their energy on fewer strategies for one big goal, and they also had a positive and significant impact. This is such an empowering discovery. It basically says that you don't have to be a full-time do-everything activist to make a huge difference. As the study's author put it, real policy change can come from more modest, more focused, and more accessible advocacy. It's about being strategic, not just being busy. So, where does all of this leave us? Well, the path to finally closing this influence gap is actually becoming much, much clearer. You know, I want to let this powerful question from researchers Jane Salvage and Jill White sink in for a second. If the largest group of healthcare providers, the ones who have the most direct day-in, day-out contact with patients, are systemically left out of decisions, how can our health systems possibly be as effective as they need to be? And that right there is why this matters to every single one of us, whether you're a healthcare pro or a patient. This is not just some internal professional issue. Bringing the nursing perspective into policymaking is absolutely essential for creating systems that are more responsive, more efficient, and, at the end of the day, just more human for all of us.
So we'll leave you with this thought. In our own communities, in our own countries, it's worth asking, who is being left behind by the way things are now? And what's our role as professionals, as patients, as citizens, in fighting for a system where every crucial voice, especially the one that's right there at the bedside, is finally heard? Thanks for watching.
I took Grace's blog and I dumped it in there, and that was the output.
Just that? Like, that
Pure
blog could have only
verbatim.
been
Just dump
500 words.
Just dump the PDF in there, and it took that and it articulated your thoughts in a different way. So let's say I start one. I create a new notebook, and it would look like this. And you upload sources. Now, it's got to come off of your drive if there's text or slides. So what you do is, if you have a Word document, you're going to want to save it to a PDF and then dump it into your Google Drive. And then from that, it'll load from here. You could also attach websites. So like, let's say it'll bring this up and you just put URLs in this, or YouTube channels, or just flat text. You can do that as well. So you put all that in there, and you have a limit of, I think, 50 sources. So let's say I took one source. Let's say I'm going to go into, let's say, this, and I dump this in here. So now I have a PDF in here. So with this PDF, it generates this. So let's say I want to study a document. I can do that from here. This is a start. I could add notes to it. I can annotate it. I can make a quick audio overview or a mind map. So if I did a mind map, it would generate some of the relationships within that document. And it takes a little bit of time to generate that. And so if you were to go about a strategy for this, you might want to create a couple of these overviews, a couple of podcasts. You might want to create a PowerPoint, which is the video overview. You might want to create a study guide, so that shouldn't take too long. Once you do that, you have several approaches to learning how to study this document, and you can do it in your car. So here's the mind map. So it kind of drills down a little bit. I'm not sure how helpful that is, but it's in there. You could generate the briefing guide. Shouldn't take too long. It's only one paper. So here's a study guide. It gives an outline of the paper. Then it gives you a quiz. Then it gives you some answers. Then you've got the glossary. So this could be an approach to learning about a particular concept, particular paper. You could create, this is a briefing document. It's a little different, but there's an executive summary. So if you want to present this, you could do this. Now, of course, you could take this and revise it and edit as you should. And you should go through it, but this gives you some basis. They have also for reports, what else was it? A timeline, that's not helpful. A fact sheet.
When you talk about revising stuff, Michael, have you been able to go in and find a way to edit like specific words, or can you edit the output from the AI, or do you have to regenerate a whole new one?
I think you have to regenerate. At this point, I haven't seen how you do that. So like for that like last briefing doc, I would copy that, put that in a Word doc, and then I would revise it and then dump it back.
Because that's
how
what's
I do it now.
important too. When we use these AI tools, they're really helpful for efficiency, or getting us started in a way that we're going to think about something, or how we're going to review and analyze and bring a concise little summary. But of course, we know that we can't just let that replace the work that we're doing. We have to use our education, our evidence-based practice and informed lenses to critically analyze what it's put out and double check and verify to make sure that all this is accurate, depending on your application, the amount of rigor that goes into that, right?
Yeah, and that's the case regardless. If you're going to do a lit review, you're going to pull that stuff in and read through it and understand it yourself. This just helps you grab some of the stuff. It's just another tool. I think you shouldn't rely on it necessarily, but sure, it seems to me to be helpful in some ways.
As thought leaders, as nurse policy entrepreneurs, one way that we could use AI to concisely convey really complex issues, right? So like our US healthcare system is really complex. But if we just had that little bit of knowledge that you just shared, that probably, maybe some people in healthcare know, or a certain amount of people in healthcare know, but the general population receiving care through this system doesn't know. Could we use something like Google LM, for example, take that health policy article that you're talking about, upload it as a source, take some other documents like, even the Future of Nursing report goes down and breaks down the different like ways that we have insurance billing, and take, for example, the MAHA report that just came out, Make America Healthy Again. Bring in sources, sharing information and perspectives. If we can share those different perspectives just to educate the public on how complex and what the consequences are, just to give like a little hint, a very concise, well understood, short audio or video about that little part of the healthcare insurance system and why the other things that we're talking about in the peripheral are important, and have it almost like, if the podcast could be like a debate style, to have a really good, robust discussion about what is next. Yes, Nina, exactly. Civil discourse. But to use it in that really short, clear explanation that AI could provide to explain to like the general public or somebody who's not in healthcare, somebody who doesn't have the foundational understanding to realize why it's important, something that could help them make their next decision in the next election.
You saw I shared the various elements, the various skill sets. This could be a great tool to help you focus in on one of those without trying to figure out it would give you the tools more rapidly and more easily available to help you prepare yourself. It's really, I think, to use it as a tool for your own self-development. I think this could be a very powerful tool. You kind of have to know how to use it, but it's getting so easy now. They're making it so usable that you're not going to have to. Before, if you had to use a computer, you had to know code, you had to know basic, or you had to know some kind of languaging. Now you don't. Now you just talk to it. Say, I don't know what you're talking about. Can you simplify that for me? And it would. You could do so many things with it. And this is in beta. This is just right out of somebody's pocket. This is nothing what it's going to be like in 2 years. So I think as far as nurses are concerned, if we jump on this technology now, I bet you there are other professions that are not going to. I think we can utilize this to improve our standing in the community. More is missed by not looking than not knowing. So simply looking, slowing down, looking and playing, in other words, play with the thing. And you are going to, this is designed to be used. It's not complex. It's not a spreadsheet where you have to learn different functions. It is so simple. Just jump into it. Get a source. It'll say add. Find a PDF that you like. Who cares what it is? Huckleberry Finn. Doesn't matter. Put it in there and then just look at what you want to do with it and start playing. The sooner that you play, the sooner you're going to go, I wonder if it does this. Oh, it does. Ooh, I wonder if it does this. Maybe. The more you play, the more you're going to shed off that barrier of, I can't do it because I don't know what to do. Let me show you. Let me walk you through this. Okay. So you go up here. See this thing? This is, you pronounce it menu. I know it's looks like it, but you pronounce it menu. These are the different applications in your menu. Scroll down until you find this thing that's called Notebook. It's got these weird little Sydney Opera House things. I don't know what it is. Touch that.
Or you could even type Google Notebook LM into the search, like you're
Or
Googling
type it into search. I'm more of a picture person because I can't spell very well. Notebook gets hard for me sometimes. So I start a new notebook. It tells you what to do here. You can go over here to your Google Drive and get stuff, or upload source. Let's say I want to choose a file to upload. I hit this. Now remember, it's got to be a PDF. Let's say I want to go over here to let's see, consulting. No, I don't want to do that. No, that's not a good. Advisory board. Let's see this. I have a PDF here. This is a handout. It's a PDF. I touch it. I can double touch it and it loads it. Now it's over here under a source. Now that I have a source, it's going to immediately give me an abstract of what's in that source. So this is if I want to look at an article. Let's say I want to look at the future of nursing document. I'd put that in there, just one document. It's going to do this. But I also say, I kind of want to hear things. I want to hear a conversation between two people talking about it. This will create, the audio overview is a podcast. Two people will just talk about this article. You can make it short, default, or longer. I think longer is about 20 minutes. You can make it very brief. So it's going to be probably 5 minutes. Or you can have a different style. This is where they critique the sources within that document. Shorter or default, so there's two lengths. Or you could have two people taking two sides and debating it. Once you hit that, let's say I'm going to hit a brief one. I hit that. Now let's say I want something in, let's say, French. I pick that. I do this. And I pick generate. So now you're going to see it go to work here. Now it's thinking. It's going to take a little bit of time, but when it comes up, then it's going to play. Now let's see what happens here. Let's see. It shouldn't. I don't think that's a really big document. It's from the hospital, so it shouldn't be very too hard to read. But are you following me so far, Eleanor? So other things that you could do with that same thing is you've got different reports. You can make a briefing document, a fact sheet, a study guide. I'm going to do study guide. So it's pulling this up at the same time. Or I could do with this video, what this is, it's more in the form of a PowerPoint. Okay, so this is done. So here's a quiz. This is on that document. It gives me a quiz. It gives me answers to the quiz. Then it has essay format quiz. This is for me learning about how to understand that document. I'm going to take each of those questions and I'm going to write short essays. I'm going to study this glossary. I'm going to do all that stuff. That will help me understand this document. Now, this will bring up the podcast. So I have this podcast and I could download it and listen to it on my phone or in my car, whatever I want to do. So it's a person talking about it. That's all it is. It's just play. It should be just like going out shooting free throws when nobody's looking. Just go out there and have some fun. I hit this button here, which was this prompt. It gave me this prompt to ask. This is a reasonable question, right? I didn't come up with it. It came up with it. And then it answered it. But it came up with some other ones. But I think if I put in here something, I don't know what the document's even about because I haven't read it in a long time. But I think that's where you do, and then that it'll show up in those notes. It'll show all of that. And then this button here, you see this? It even helps you with a narrative under it, copy. You take that, it's on your clipboard. Now you can dump that onto a Word document and you can mess with it.
If you look at the center there, you have the numbers 24, 25, 22, 23 in the middle of all that text. Does everybody see that?
Yes.
Yes.
That's where it's pulling the sources. So if you click on that, Michael, hover or click, at the end of that paragraph, it says 4 and 7. When you click on that, he just clicked on that and it brought exactly to where that part is in the source that you uploaded, where it's pulling that information from. So it's like a reference.
Yeah, like a citation.
So now we're playing. This is what you do. You just play. I wonder what that does. You're not going to break anything. Let's say I only want to pull up something with only this one. Then I think I would discover sources. I'm not sure what that is. But you could select all of these too, some or all of them. Not sure if that would open a separate thing. I haven't played with it enough. But you could tell there are a lot of functions on here. And we'll get to it. The point today was to introduce you to something that should be interesting. It should inspire you to ask more questions. It should also inspire you to do something and to dig into it. Not just to dig into it, but to say, I wonder how this can help me work on my hot button. I wonder how this can help me, and then let's start playing with it. Because if you've got to apply it, the whole point of the community here is to apply it to your effectiveness as a healthcare reformer. That's the goal. There might be a committee meeting. Let's say the Senate has a committee, healthcare committee minutes. You pull that up there, pull that in there. Then you could see the discussion and you could understand the discussion. You could do a podcast brief overview of it. So real quickly, you could hear everything that took place in there in a couple of different formats, iterations, so you have a better understanding of it.